All right, good evening everyone. Good evening to you. Welcome to Ask Dr. UTHUMAN YouTube channel live. And if it's your very first time to watch this channel, please do not forget to subscribe. Actually, this should be your very first item to do if it's your very first time to watch our channel. So subscribe and then we continue. Now today in our live, as usual, it's you guys are just supposed to ask any questions of your choice, but those questions should be regarding reproductive health. Ask me things concerning fertility management and reproductive health. Those are questions I can readily answer. So the other time in the previous lives, some people were asking me about questions which don't really come into my line. So I would like you guys to be specific with questions of reproductive health, questions of reproduction, questions concerning maternity. Those are the questions I really welcome. Thank you so much and welcome to my live today. It's 4th of January 2024. Welcome to 2024. And this 2024, we are going to be very, very serious with your questions. So right away, I think I'm going to start answering these people with the first questions. And the first question comes from who? Okay, we have many people following us, both on YouTube and on TikTok. And thank you so much for following us. So let's straight away, we have Egbon Johnson. Good evening. Nicodemus, hi doctor, how are you? All of you are just still greeting me. Joan Sentongo, how are you, my sister? And then many other people here. All right, let's start off with this first question. It says it comes from Egbon Johnson saying, oh, you've retrieved the question. All right, let's go to Sophia Chipman. Sophia Chipman is saying, can UTI cause miscarriage at 7 months? Yes, a UTI can cause a miscarriage at 7 months. Not even 7 months, but at any stage. And by the way, most times 7 months may not be termed as a miscarriage, because if you look at 7 months times 4 weeks, that is around 28 weeks plus. So that will not be a miscarriage, but it will be preterm labor. So we call that preterm labor. When you lose your pregnancy after 28 weeks of amenorrhea. Now, but again, it depends also in the area where you are. When you're in most of the African countries, Uganda inclusive, we start calling it premature. We call the fetus viable at 28 weeks. Okay, but in countries like US and UK, actually US they start from 24 weeks, and UK and some other European countries start from 26 weeks. So we call it a miscarriage when it is below those weeks I've talked about. But above that, for example, if you're saying your 7 months, it was 7 months, that will be preterm labor. So it is possible for a UTI to cause preterm labor. Yes, another question. This one, Kechi Gambiro Morin is saying, been waiting for this live. All right. Now here, Nantongo Rita, how can I get pregnant after taking Clomids? What do you mean? After taking Clomids, I hope you've taken Clomid during the right time, and I hope Clomid is the right medicine you're supposed to take. Because some of you really take Clomid when it is not the right medicine you're supposed to take, okay? Clomid is taken after finding out that probably the problem with you is LH, is low levels of luteinizing hormone and follicle stimulating hormone. But when Clomid is taken, depending on also the length of your menstrual cycle. What is the length of your menstrual cycle? That is when you start taking Clomid. Now, depending on the length of your menstrual cycle, you will calculate your ovulation day, and those are the days you can get pregnant. I don't know if I've answered you or not, but your question was how you can. You said how can I get pregnant after taking Clomid? So after taking Clomid, hoping that you've taken it during the right time, then you're supposed to have intercourse during the fertile days, then you'll be able to conceive. except if you have any other problem. Then we have another one. This one is called who? Mba Acha is saying, can you be pregnant for 3 weeks and you breast flow? Your breast flow. What do you mean? What do you mean? Please, I don't understand this clearly. Can you be pregnant? Someone help me. What is she meaning? Can you be pregnant for 3 weeks and your breast flow? I don't know. I don't know what you really mean. Ask the question very well. Grace upon Graceals is saying, Grace upon Graceals is saying, Doctor, I always have severe abdominal pain 3 days after ovulation. I also have blood clots in my menstruation. I have been trying to get pregnant for 5 years now. Now, pain after ovulation, that is normal. It is as a result of hormonal fluctuations. That is normal. But when you say that you've been, it has been 5 years, you're not conceiving, we need to ask ourselves the following questions. Number one, before you call it infertility, number one, you've been 5 years no pregnancy. The first question is, have you been having a man for all those years and having unprotected sexual intercourse for at least 3 times a week? That is the first question. Because let me tell you, guys, I had someone here who was saying that she's failing to conceive for a period of 3 years and asking, she had someone, but they could use a condom. Okay, in a week, one time unprotected sex, and then the other time they are using a condom, and they are saying that she's infertile. So when we told them to just take off the condom and go live, she conceived. So at times, that's why I don't take things for granted when someone tells you. I have to be very sure that what I'm thinking is what you're thinking. So if you fulfill those conditions for all that period of time, that means there is a problem somewhere. If you fulfill those conditions and you still don't conceive, it means there is a problem somewhere. Where could the problem be? The problem could be with your man. We need to first ask, have you been with this same man for all those 5 years, or you've tried somewhere, somehow, with someone else and it also failed? But if you've been doing it with only this man, then we need to find out whether this man is okay. Whether this man is okay. So that means the first test you'll do is to go and do a sperm analysis for your man. After doing a sperm analysis, if the sperms are okay, then the next thing will be you doing tests. Which tests are you going to do? Do a fertility hormonal. In other words, go to the hospital and do what they call a fertility screen. I've always talked about a fertility screen. A fertility screen contains all those tests that can tell us your fertility status. Where do you belong as far as fertility is concerned? Yes, Irene, good evening. How are you and where are you calling from? Be loud. Irene 32. Irene 32, be loud. I'm going to take you off if you are busy. Irene, okay, I think you're calling and then we have another question here, and it is coming from okay, doctor. Okay, this one is saying, Mase Mwale, good evening, doc. Is there any medicine for one to conceive twins? Yes, medicines for conceiving twins are there. There are medicines, yes, medicines for conceiving twins are there. They are there, yes, they are there, and but they are given depending, you start them depending on the length of your menstrual cycle, and those medicines include letrozole, tamoxifen, clomifen, and menapa, and so on. Those medicines can be used to cause hyperovulation. User 28005, how are you and where are you calling from? Be loud. Then, I think this one is also... Okay, then we also have another question from Mba Acha. Can inflammation pills cause miscarriage? Which ones specifically? And when you say inflammation pills, they are not inflammation pills. They are called anti-inflammatory drugs. Anti-inflammatory drugs. They can be NSAIDs or steroids. So which ones specifically? Let me know the exact drug you're talking about. Then I will let you know if it can cause a miscarriage or not. We have Nicodemus Majok McCoy. Yes, Nicodemus, how are you? Doctor, my hand is up. Is rash in every season? How can I know that? What do you mean? Doctor, my hand is rash in every season. What does it mean? Kesbaga, it's you who understands English so well. What does this mean? Doctor, my hand is my hand, then he puts the sign of a hand up. Is rash in every season? How can I know? I think the question is not clear. Nicodemus, please ask the question clearly. This English is not Englishing. Then we have Yvonne Franklin is saying, my question is about abnormal menstrual bleeding. How can someone normalize bleeding? What exactly do you mean? Because when we say abnormal menstrual bleeding, there are many types of abnormal menstrual bleeding. We have what we call dysmenorrhea, whereby someone is having pain during bleeding, during menses. That is an abnormal bleeding. Then we have menorrhagia. Menorrhagia is when someone has heavy bleeding, and that is called menorrhagia. And there are those who have both this and rhagia, so we call it dysmenorrhagia. Then we also have those that get little blood, just spotting, and also those that don't see blood at all. There are those that see clots and so on. So what exactly are you talking about? Sophia Chipman, what medicine can treat UTI? Antibiotics. Antibiotics, you can take antibiotics of your choice. We have several antibiotics. We have the quinolones, like the ciprofloxacin, levofloxacin, ofloxacin, etc. Those ones can treat. We have classes. You can go to cephalosporins. Classes like ceftriaxone, that is injectable. We have cefalexin. We have cefixime. All those drugs can treat a UTI. Then you can go to the other one, the Zahas, the azithromycin, amikacins, and so on. There are several, in other words, those antibiotics, there are several antibiotics that can be used to treat UTIs. However, I request that before you really go on for treatment, you do that urinalysis, and if possible, you also do a culture and sensitivity test to identify which antibiotics will work for you. It's always not good to just take any antibiotics. Better, if it's possible, you can first do a culture and sensitivity. Actually, what you can do is to take off urine for culture and sensitivity, then you take the antibiotics available. When the results come back, depending on how the results will be dictating, you can now move forward and get to know what to do. Then we have Shelleen Malcolm is saying, what do you know about pregnancy of unknown location? Had a scan and it wasn't an ectopic, but there wasn't anything showing in the scan. There was no viable pregnancy. Now, this is very interesting. Pregnancy of unknown location. First of all, it is either, number one, a blighted ovum, or, actually there are three, a blighted ovum, or what you can call a missed abortion, or there is an ectopic, and the pregnancy is somewhere. You see, for you, you only think that ectopic fetuses, during the ectopic pregnancy, the fetus is supposed to be maybe in the tubes or the ovary. There are times, I think you've seen the news, I think that was around the COVID time in 2020 or 2021. A scenario came in Uganda here, in Soroti, and the fetus was found on the liver. So they had they operated this woman, and the baby was delivered from the liver. The liver. So at times, yes, the scan may be looking only around the pelvic region when the baby is somewhere else. We've seen, I'm telling you, some babies are very stubborn, and I think some sperms and some eggs are also stubborn. Imagine the egg comes from the ovary, just in the uterus. Then the sperms are just here from the vagina, from the cervix to the uterus, the fallopian tube. Now, instead of these guys meeting there and the fetus grows from there, stubbornly, they move out. They move out and you find them in the intestines. Now, for such babies, the fetus was found on the liver, up here. The liver is up here. Okay? So what we are trying to say is that for you may be looking for the fetus down when the fetus is up. So just check around that. In other words, I would advise you to do a very serious scan. Let the radiographer be very serious and look for the fetus from all the angles of the pelvic region and the abdominal region. You may find the fetus there. If the fetus is not there and the urine HCG or blood HCG is showing positive, then we are likely to be having a missed abortion, or a blighted ovum, or a complete abortion. That's it, done. Eggborn Johnson is saying, where is your question? It's running away, running away. Okay, it's here. How can I know if I'm conceiving with the twin with my 7 weeks ultrasound scan? Yes, a 7 weeks ultrasound scan can try to predict that you have because there is a gestation sac, and and by the way, at 7 weeks we even have we are likely to be having a fetal heart. So at 7 weeks it is very possible, though some ultrasound scans may have a poor resonance, but those good ones can be able to show you that you have twins. Then we have Newskin Lord Beauty saying, it's now 5 months when I'm taking microgynon to control the heavy bleeding and the doctor failed. You see, if you're saying you have heavy bleeding, what is the cause? Before you take this microgynon, before you take any medicine, let's first know what is causing that. What I would request you is to do fertility hormonal assay and a pelvic ultrasound scan. Those ones will be able to predict what is causing this heavy bleeding. When we know what is causing the heavy bleeding, then you can take the right medicine, okay? Then we have Mirembe Florish is saying, Doc, I did HSG and the result was my tubes are blocked. What can I do? Unblock the tubes. Blocked tubes can be unblocked. I told you that this is one of the treatments of infertility. When someone has blocked tubes, they can be unblocked. I've always told you about the different methods we can use. We have several methods we can use to unblock the tubes. I've always talked about tubal flashing. I've talked about canalization or catheterization. I have always talked about tubal surgery, open surgery. I've always talked about laparoscopic surgery. So all those ones can be used to unblock the tubes. Don't sit there. You're failing to get pregnant because your tubes are blocked and you're not doing anything. Then we have Ross Tachola is saying, Doctor, how to treat PID? PIDs, most PIDs, I think I will generalize. I've always said that PID is a pelvic inflammatory disease. These are mainly sexually transmitted infections. They are mainly sexually transmitted infections, and most of them include, the culprit bacteria include chlamydia, trichomoniasis, and several other bacteria. But chlamydia, trichomoniasis, and it can even be treponema, it can be E. coli, it can be any other bacteria there. So the medicines supposed to treat this are the antibiotics. So depending, now there are several classes of antibiotics like I've been talking about. We have the likes of fluoroquinolones or quinolones. We have the likes of cephalosporins. We have vancomycins, etc. Take around that area. We have medicines like I've talked about cefalexin. You can now, but with a PID, I always encourage people to mix 3 drugs or to combine 3 drugs. Number 1, use a cephalosporin or a quinolone. That is to say, use cefixime and cefixime or levofloxacin or ciprofloxacin. One of those with doxycycline. Okay, with doxycycline or any tetracycline, if someone is allergic to doxycycline, plus an anaerobe, okay? Plus an anaerobe. An anaerobe can be the likes of metronidazole, can be the likes of tinidazole. So we are supposed to at least see 3 types of drugs when we are treating PIDs. Okay, and if that PID is also associated with vaginal discharges, okay, like white discharges that are and also itching, vaginal itching, then you are going to use those medicines alongside pessaries or antifungal pessaries. I think I'm very clear there. Sylvia wa Aliana. Dr. Nzenina Echizimba, sorry, we use only English on this channel. I'm very sorry. Yes, I understand the language you're using, but for the interest of my channel, of this channel, and all my viewers, we only use English. Thank you so much. So you can ask your question again in English. Then, how to conceive twins? Kerubo is saying, how can I conceive twins? We've already said here that when someone wants to conceive twins, what we are supposed to do is doing hyperstimulation, hyperovarian stimulation. We stimulate your ovary to produce 2 eggs. I've said here that when someone, I think I need to demonstrate this here. Let me demonstrate it for you. Let me demonstrate it for you. Let me demonstrate it for you. We have this uterus here. We have this uterus here, okay? We have this uterus here. I think everyone can see it clearly. Now, every month, this is the ovary. This is the V, where everyone enjoys. You people enjoy this part so much. This is the V plus V. Then this is your cervix, the womb, fallopian tubes, and the ovary. So every month, the ovary produces produces 1 egg, releases 1 egg. And this, for example, this is left, this is right. So every month, the system decides to either release an egg from the right side or an egg from the left side. That's why someone is able to only produce or to conceive with 1 baby, 1 fetus. Now, if we want you to conceive with the twins, we give you medicines that contain a hormone called LH and also FSH. These hormones will be able to boost this ovary, all these ovaries, either for this 1 ovary to produce 2 eggs or for both ovaries to produce at least an egg. So when they produce an egg and you meet with someone, then you'll be able to conceive from both sides of the tubes, okay? And at the end of the day, you'll end up having twins. Therefore, the medicines we use here include the likes of tamoxifen, okay? We use medicines that include likes of letrozole, okay? We use medicines like clomiphene and so on. But now when we are using these medicines, we depend on the length of your menstrual cycle. We depend on the length of the menstrual cycle. We don't just take those medicines for, okay? We depend on the length of your menstrual cycle. Sorry. We depend on the length of the menstrual cycle because, yes, those medicines are supposed to be taken, but the dosage and when to start these medicines will depend on the length of your menstrual cycle. Therefore, I would ask you, these medicines should be given with guidelines of your doctor after also doing 1 or 2 tests for you. Then you can be able to conceive twins. Then we have Mirembe Flori. She's saying, Doc, I did HSG and the result was my tubes. I've already talked about this. Mba Acha is saying, is it normal for breast to flows when you are 3 weeks pregnant? I don't know what you're really meaning, but you are likely to be meaning, to be asking whether it is normal to have breast milk. I think that's what you're asking. So it is really not normal to have breast milk when you're just 3 3 weeks pregnant. That is not normal. It is not normal. I agree it is not normal. Though the breast can have a little fluids, but not that flow when someone has really that too much breast milk at just 3 weeks. So I would say it is not normal. Then we have someone else, Aisha Shah is saying, if no periods, then which maid should take for periods? All right, if there are no periods. Now, there is a video, I think I released a video. Check on my channel, on this channel, on my YouTube. There is a video where I was talking about how to bring periods back. I released a video concerning how to get periods back. Women with no periods, all what we call amenorrhea. How can it be treated? That video is very clear. So after this live, please go and check that video concerning how to bring periods back. But to bring you to close to this, number one, mainly, and I will talk about the 2 main causes of no periods. Number one will be presence of fibroids or leiomyomas in your uterus. When you have fibroids, it is likely that you have no periods. Though some people have fibroids and they just have irregular periods. For some other people, it causes no periods, fibroids. Number 2, it may be hormonal imbalance. And the culprit hormone here is usually progesterone. Women with low levels of progesterone and high levels of prolactin are likely to have no periods. Women with low levels of progesterone and high levels of prolactin are likely to have no periods, all irregular periods. Okay? And all, if this woman, and most of them, some of them have used contraceptive pills like the emergency pills, the likes of the Lydias, the backup, the Postino, and so on. Those pills you are using, so they can lead they can cause this hormonal imbalance, and you end up not having amenorrhea, even the implants of this world. So when you have this, the first thing you're supposed to do is to carry out tests to confirm whether the ones I've talked about are the culprits, which one exactly is causing your amenorrhea, which one exactly is causing your no bleeding. When you know what is causing your no bleeding, then you can take medicines. Several medicines are available on market which can be able to bring your periods back. Now, what you are supposed to do, got one of my videos on YouTube which is talking about how to bring my periods back. You'll be able to understand that. Then we have Yosh Explorer is saying, "Hell, doctor, my question is, how can I have pregnant and my uterus cute one side and is now 5 years?" Oh, seriously, I don't understand your question. Hello, doctor, my question is, how can I have pregnant and my uterus cute one side and now is 5 years? I really don't know. Please ask the question again. Kindly ask the question again. I'll be able to answer you. Eggborn Johnson is saying, "Can I know if I'm conceiving with a twin with a 7 weeks?" Yes, 7 weeks ultrasound scan can show you twins. Yes. Another person here is saying, okay, where the question is running away. Okay, Kechi Gabiro Morin, doctor, I did T3 2.3 prolactin. What are you trying to say, Kechi Gabiro Morin? Anita Arthur, doctor, please, what causes multiple miscarriages and how can you prevent it in subsequent pregnancies? Now, this is a wide question. Causes of recurrent, I think you're talking about recurrent miscarriages. Recurrent miscarriages can be caused by, number one, infections. That is infections. Number two, recurrent miscarriages can be caused as a result of blood group incompatibility, or what we call the Rhesus factor incompatibility. People with problems of Rhesus factor incompatibility, whereby your blood group is, for example, A+ or A-, but your husband or your spouse is A+. That is what we call blood group Rhesus factor incompatibility. This person is going to be having recurrent miscarriages. and those miscarriages are usually below 3 months. Those miscarriages of Rhesus factor incompatibility are usually below 3 months, or below 12 weeks. Now, another cause can be as a result of uterine cervical incompetence. Cervical incompetence. What do we mean by cervical incompetence? These are women that have a weak cervix. What is a cervix? If you look at this diagram here, this is the cervix. Okay? So I told you this is your V. This is the vagina here, where you place sex from. When you place sex from here, you will deposit sperms here. Sperms will move through the cervix. This is the cervix. They will move through the cervix and go to the fallopian tube to form a baby. When the baby is formed from here, the baby has to be moved back into the uterus. When the baby is in the uterus here, this cervix is supposed to be closed. The cervix is supposed to be closed throughout the pregnancy and only opens during parturition or during labor. And I think most of you women who have ever produced have gone to the hospital and have gone to, when you're in labor, the midwife will tell you, don't push. Don't push before the cervix opens. Because most of you are in pain and you want to push. Every time the contraction comes, you want to push. Yet the cervix is not open. What does it mean? That the cervix is always open up to labor. So once it fully dilates, it is always closed up to labor. Once it opens, dilates, that's when the midwife will tell you to push. Okay? So now, if this cervix opens before viability, before the baby is fine, before the baby is mature, you'll have a miscarriage. And this is called cervical incompetence. Either the cervix is short or the cervix is weak. Okay, the thickness, it is thin. A thin cervix will cause those miscarriages. Another reason as to why a woman may have do you have a network issue there? Resolved? Is it resolved? Network? It's okay. Okay. Sorry, just a second. I'm resolving some network issue here. Okay. Coming back. You're fine? Okay, all right. So another problem may be as a result of chromosomal abnormalities, okay? Women with chromosomal abnormalities, if you have a chromosomal abnormality, you may have a problem with miscarriages and you may end up having miscarriages. So I think that question is also settled. Let's go to Nicodemus McCoy saying, sorry, I mean my hand itching and the skin is rushing in every December to March. Oh, all right, now that's an allergy. Probably there is that weather or there is that condition, the weather condition around that time is not favorable for your skin, and you end up with an eczema, which is which is allergic. That is an allergic eczema. Okay, then we have another question from Mase Mwale saying, Doctor, I did fertility scan and I was told I'm just okay, and my husband has a child somewhere and we have been trying to conceive but nothing is happening. What can help us? All right, so if the scan is okay, that is not the only fertility screen. That is not the only test we do for infertility. Please go on and do other tests. We have several tests that can be done to confirm whether you're fertile or not. We have several tests that can be done to confirm whether you are fertile or not. Example of those tests include the fertility hormonal assay, the HSG X-ray. Please do those tests, identify what is happening to you, then you'll get treatment for your problem. Okay, then I think at this time, this material time, we are going to say bye-bye to those of you on TikTok. So find us on YouTube. So we are saying bye-bye to TikTok, and we are continuing our conversation on YouTube. If I've not answered your question, just go to your question. So right now, we are switching to YouTube. Thank you so much. Go and look for Ask Dr. UTHUMAN. That is the YouTube channel. You'll find us and ask your question. I sign out on TikTok and only remain on YouTube. Yes. All right, we are continuing here on YouTube. Welcome back. So we have more questions here. We have someone is called, okay, these questions are running away. The questions are running away. All right. We were dealing with Masemale. I said, Masemale, what you're supposed to do is to run several tests, okay? Run several tests to identify what is causing your infertility. It is not only the ultrasound scan that can show you whether you are fertile or not. Then Millicent Akoff is saying, good evening, doc. How can one calculate pregnancy by weeks using the concept of missing periods? Thank you. Now, when we are calculating the weeks of pregnancy, we calculate the weeks of amenorrhea. How to calculate the weeks of amenorrhea? You start from the first day of your last menstrual cycle. Most of you do not calculate very well. You calculate the day you had sex. And that's the day you start counting. Now I'm 2 months pregnant. Now I'm 3 months pregnant. Now I have these weeks of pregnancy. No. When you see your periods, when you start your periods like this today, that is your first day. If the subsequent days, in other words, if you don't see more periods, if you don't undergo menstruation again, we shall call the other day, we shall start from the other day, count the number of days from there up to the time you want to calculate, up to date, and find how many weeks are in between there. That is how we calculate the pregnancy maturity. Then we have Obianudo Osai saying, doctor, when one have pain in the womb after 2 to 3 days after having sexual intercourse, what is the cause of that pain? More likely to be a pelvic inflammatory disease, PID. PIDs are the ones known to cause pain during sexual intercourse or pain after sexual intercourse, and that is called dyspareunia, and mostly those are PIDs. And if it is not a PID, it may be something else like a UTI, it may be an ovarian cyst, but mostly those are PIDs. Grace upon Greso is saying, clot in menstruation. What do you mean, clot in menstruation? What do you mean, clot in menstruation? Shamali Philip, what can treat high prolactin levels naturally? Naturally, I may not know, but artificially or medically, I know that you can use bromocriptine, you can use cabergoline to treat high levels of prolactin. And also, check one of my videos. You check, there is one of my videos talking about high levels of prolactin, and I discussed that thoroughly. Check in one of my videos there, and find out one of my videos where we're talking about how to treat high levels of prolactin or hyperprolactinemia. By the way, if it's your very first time to watch my channel or to watch these lives, please do not forget to subscribe. Please subscribe, also press the notification bell in order to be notified of any important video we make. And also, because when you subscribe and put a note and press the notification bell, when we are going to have a live, we shall notify you. You will know that we are live. But if you don't subscribe and if you don't also press the notification bell, you will not be notified that we are having a live. It will be accidental for you to know that we are having a live. So we are continuing with these questions. At least today I want to really finish all these questions within this time I have, which is 1 hour. Then, okay, Sarah Ajay, doctor, please, what causes fibroids? Fibroids are caused by prolonged exposure of estrogen in your blood. Prolonged exposure of high estrogen levels in blood. That is the main cause of fibroids. Buba Banda, your teachings well understood. Happy New Year, Doc. Thank you so much. Charlene McClom is saying, if your HCG levels dropping within pregnancy, does it mean it's failed pregnancy? Yeah, more likely. Except if the pregnancy has reached maturity, but more likely that it is failing. So what are you supposed to do? I think that is the most important thing. Get an HCG injection and increase their levels. Yes. Then we have Charlene Maclom, I think that's the question. Megwa TV, thanks for watching us. How costly is doing culture and sensitivity test? It depends on where you're doing it from. Government facilities do culture and sensitivity tests freely. Okay? But it depends on where you're going to do it from. Are you doing it where? It depends on the country. It depends on the hospital where you are doing that test from. So I may not tell you how much it costs, but I think it's not a money. It's not a lot of money. Spora Manusa Doc, is spotting a sign of pregnancy? Oh, yes, it is. Spotting, especially on the 12th week, can be a sign of pregnancy, and it can be a sign of implantation, what we call the implantation of bleeding. Yes, it can be a sign of pregnancy. Madina Binti Musa is saying, thank you for teaching us, all right? Rosta Chola Doctor, can PIDs lead to cancer? In the long run, if they are not treated really well, if they are not treated very well, and you have those recurrent ones poorly treated, somewhere, somehow, yes, but it is not a direct connection. There is no clear direct connection between a PID and a cancer. But it can lead, if it is really prolonged, chronic PIDs, not poorly treated, and so on, somewhere, somehow, yes. Kakara, how can I conceive on perimenopause? What supplements and where can I get them? Now, when you are entering your menopause, it becomes a risky stuff because when you're entering your perimenopause, there are a lot of hormonal fluctuations, and most hormones go down. The likes of progesterone will go down, okay? The likes of these hormones, the AMH levels will go down. And when AMH levels go low, it is indicating a poor ovarian reserve. So therefore, problems come in. Now, what are you supposed to do when you're approaching that period, or when you're in that period and you still want to conceive? You need to go to the hospital and run what we call the fertility screen. The fertility screen will be telling us your fertility status, your fertility potential. IT.next. Please don't forget to subscribe to that channel. IT.next is the man behind my camera here. Now, what I'm saying is that you check your fertility potential. When you check your potential, you will be able to know how many eggs you are left with, the levels of your fertility hormones. How is your uterus? Is it not shrunk? How are the eggs still there? Are they still viable? Don't you have tubes that are blocked? Is the uterus normal? You don't have any mass? Those are the tests that will be telling us your fertility potential. Now, when we know your fertility potential, medicines can be started to correct what is going wrong. You see, when you ask me that which supplement, which medicine can I take, I may not tell you a specific medicine unless we know your fertility potential, we know your fertility status. We've done what they call a fertility screen. If you've carried out the fertility screen and we know your fertility potential, we can tell which medicine is to get. And everyone is different. I cannot tell you to take clomiphene. I cannot tell you to take letrozole. I can't tell you to take an HCG injection. I can't tell you to take progesterone medicines because everyone is different, unless we've done tests to confirm that this is exactly what you need. I have seen several people on the internet telling you, you failed to conceive, take this medicine. Before you take the medicine, ask yourself, what is the problem with me? Why am I failing to conceive? That is the first thing. If you don't know the reason, if you do not have the cause of your infertility, you are taking medicines for nothing. We use what they call evidence-based medicine. This is modern. This is the modern world. No guesswork. No room for guesswork. Modern medicine deals with research. Evidence-based medicine, evidence-based prescriptions, not guesswork-based prescriptions. We go to Shy Girl 30. Shy Girl, okay. What caused a person's head to get hot? Oh dear, I said ask me fertility questions. Now this doesn't look to be a fertility question, but in most cases maybe you have, that's a fever of course, maybe you're having infections, you have malaria, you have any diseases. The body may react by increasing the temperature of your body. So, Esther Mumo is saying, I stopped using pills in September and I've been trying to get pregnant. Doc, help me. If you stopped using pills in September, that is today, this is January, it's hardly 3-4 months, then that is not a big deal for now. We start calling it infertility or subfertility. When you reach 6 months, we call it subfertility, and that's when investigations can be started to identify what is the problem. But before that, because some of these, and those hormones cause fluctuations, okay? So when there is hormonal fluctuation, of course, you'll not be able to conceive. So you first allow this medicine to get out of the body, and they get out of the body with time. Sometimes 3 months, 6 months, and above, they get out and you can be able to conceive. So for now, I would advise you to be a little patient, up to at least 6 months. Okay, this one is saying, Linda Mulera, hello doctor, I conceived when it was after C-section, which happened due to pre-eclampsia. Now I'm likely to do a VBAC. I wouldn't advise you to do a VBAC. Please take this at least, even if you're not colleagues, please, my followers, even if you're not to understand anything out of my life today, even if you've never understood anything out of my videos, I pray that you understand this. Please, conceiving 6 months after a cesarean section is already a risky activity. That is already a risky pregnancy. You're carrying the fetus, the baby, under risky conditions, because after cesarean section, we advise at least 18 weeks. So you conceived before that. 6 months is too little for proper uterine healing. Now, if all goes well and your pregnancy reaches maturity, then do not risk again by going to deliver normally using a VBAC. What she's calling a VBAC is vaginal birth after cesarean section. Do not risk. That is automatically a cesarean section. What am I talking about here? I think if I just leave it lightly like that, you won't understand. Understand it from this angle. Understand it from this angle. I have said even if you don't understand anything, you see, during a cesarean section, we cut your uterus. Then after cutting, we suture it. So where we've sutured it from is an area of weakness. Remember, this uterus, by the time we cut it, it was as big as, when you're pregnant, it's like this, very big. After cutting and we've removed the baby, whatever the case may be, it goes back to the size of a fist. Now you conceive. Every time the baby is growing, the uterus keeps on expanding. What is happening here? Let me give you an example. If you look at, for example, let's look at this. If you look at this hank here, it is strong, very strong. even when you apply pressure, it may not be able to break or to tear. But if something happens, if someone comes and cuts here, then sutures or tailors this stuff back. You cut here and you tailor this part back. Then if there is any pressure or force applied, the area that it will break through the lines of weakness, through the areas where suturing occurred. I don't know if you people understand. So now if there is a fetus, if you conceived before 6 months, within 6 months, now imagine during labor, contractions, and so when there are contractions, you are pushing, you may end up rupturing your uterus. Therefore, I wouldn't advise you to do a VBAC if you've conceived before 18 weeks. I think Linda Mulera, you have understood. Aisha Shah is saying cause of PCOS, no periods. Then which medicine should I use? PCOS, that is polycystic ovarian syndrome. If someone has polycystic ovarian syndrome confirmed, I would advise you to do fertility hormonal assay and sugar levels. But after that, you'll be able to take medicines containing inositol, medicines of like PCOS. Those are medicines. We have Rimona. All those ones are medicines that can be used to treat polycystic ovarian syndrome. But when we are using those medicines, sometimes we also add medicines like glycemic diabetes. Okay, but that's why I've told you have to first do the other test to confirm, to rule out diabetes and so on, all to look at your sugar levels. Okay. Oh, questions are many. I hope I finish them in this period of time I have. Okay. Okay, all right. Sahara A is saying, I can't thank you enough, doctor. I have been learning each and every time I'm watching you. God bless you. Thank you so much, Sahara A. Yosh Explorers, doctor, mattress have problems, so they cut one side. Now my question is, can I have a child? It's now 5 years. Yes, but depends on, there are some people that get subtotal hysterectomies. They cut some parts of the uterus. Yes, those people can conceive, but it also depends on the part which was cut and also the size, the how big the part that was cut. That also depends. That means depending on the doctor's report, the report, because in the report they will state how much was cut. Okay, so yes, sometimes you can conceive, but others may not be able to conceive. Okay, Sahara A, you're good. We can hear you, doctor. Right. Anita Arthur, can you detect incompetent cervix on ultrasound scan? Yes. Caesar Remy, hey doc, what causes irregular periods and absence of ovulation? Which medication can I use to regulate my periods? It is as a result of hormonal fluctuations, hormonal imbalances. Which medicines to use? First, do tests to identify the exact cause, the exact hormone. Because when we say hormonal imbalance, a woman has many fertility hormones. So which one exactly? In most cases, it is progesterone. But first do tests, identify which hormones are imbalanced, and then get medicines. Medicines will depend on which hormone has a problem. Nicodemus Majok saying, thank you so much. Welcome. Okay, he's giving us hearts. Okay. Then we have Nasuna Swabra. I'm using copper IUD, but I'm spotting instead of actual bleeding. Could I be pregnant? Yes and no. First of all, go and carry out a pregnancy test. If it's positive, you are pregnant. If it's negative, you're not pregnant, because sometimes that device can cause spotting. Nancy Slick Doc, Doctor, I am O plus and my husband is AB negative. Do we have compatibility? Yes. Yes, these are the examples I was trying to talk about. I have had one miscarriage due to weak cervix, and the doctor never spoke about Rhesus factor incompatibility. I don't want to speak about what the doctor didn't talk about or whatever. But husband is AB negative. That is automatically Rhesus factor incompatibility. And what I can tell you, every pregnancy you will have to get out. You'll be having miscarriages every time you conceive. Rhesus factor incompatibility is very serious. And now, what are you supposed to do? What you are supposed to do, we were supposed to do that when you had the other miscarriage. You were supposed to take the anti-D drug, the anti-D injection within 24 hours after miscarriage. Now, if that failed, okay, in case you conceive, you'll have to take that anti-D at 28 weeks. When you give birth, you'll have to take an anti-D within 24 hours. When you get a miscarriage, take anti-D within 24 hours. After taking anti-D within 24 hours, when you conceive again, take anti-D at 28 weeks. I think I'm very clear. This is the example I wanted, and someone is bringing it. Shamira Kantengwa. Hi, doctor. Is erectile dysfunction treatable? Yes, it is treatable if the cause is known. Sometimes it's as a result of diabetes, it is as a result of hypertension, or a problem with the vertebral column. If someone has problem with the vertebral discs and compressing the nerves that pass through. Okay. Auma Bena, good evening, doctor. What's the time? Good evening, doctor. Thanks for the program. What causes burning in the vagina and the anus? Those are infections. If those are infections, but sometimes it can be perimenopause symptoms. But perimenopause symptoms will only happen in the vagina, not in the anus. 3 minutes left. All right. Alex Moy, Dr. Alex Moy again. You didn't answer my question, please. Now, seriously, when I don't answer your question, instead of just saying you didn't answer my question, just bring the question back. Okay, even if you said, doctor, I didn't answer my question, then you put the question there. Because, you know, when I'm scrolling, some questions gets, I scroll some of them, I skip them. And so if I've not answered your question, just bring it back, okay? So bring the question back. It is not intentional. I can't intend to not to answer someone, because all of you here, I don't know you. I don't know you. I just answer any question I see. So I'm not segregative because I don't know you guys. Katusime Oliver, hello doctor. I did HSG. My tubes was blocked. I tried HT. What is HT? 7 times. What is HT? I don't understand it. 7 times it didn't work, and I have endometriosis and PCOS. How can I get pregnant? Katusime Oliver, these are multiple problems. I cannot give you one answer, because we have endometriosis, we have polycystic ovarian syndrome, we have blocked tubes. Really, I would request you, again, I would request you to go and have a one-on-one with a doctor. Discuss on this, because you need to treat PCOS. You need to treat, to unblock the tubes. And then for this, endometriosis can be dealt with drugs that cause hyperstimulation. Then we have Rachel. Rachel I is saying, hi doctor. I have been trying for 6 years after my second child. I have checked and it was recorded as unexplained secondary infertility. I am currently on Vitex and omega-3. Is this okay? I would say no. Because to me, seriously, okay, yes, there can be unexplained infertility, but were all the tests done? Did we do all the fertility screens, all the tests? Because I am telling you, in most cases, when someone is infertile, when someone is not conceiving, there is a cause. Let's first identify the cause, then you can get treated. Okay. Then we have, I think this may be our last question. Okay. Okay, this may be our last question. Diana Boateng, how can I get pregnant after my periods? Really, I think I answered this question. After your periods, you can get pregnant during your fertile days. We don't look at after your periods. Just know what the length of your menstrual cycle is. Calculate the fertility days, calculate the ovulation days. Have sex during those days. You'll be able to conceive. If it's your very first time to watch my channel, please do not forget to subscribe. Please subscribe and also press the notification bell so that you can be notified when we put up a video or when we are live. And also remember that I'm always live on Thursdays at 7 hours East African time, or 19 hours, 7 p.m. or 19 hours East African time. And those of you who have issues with your IT issues, you go to it.next, subscribe to it.next. it.next, it is on YouTube. Subscribe to it, you'll be taught various things concerning IT. And this is the man behind my camera here, Casebag, it.next. Say hi to people. And those of you who would like to have a private chat, a private conversation, to have a chat with only me, those of you who are shy to put questions here, go to my website, www.druthuman.com, and book an appointment. I'll be right there to chat with you. Otherwise, I sign out. We meet next week, same time, same day. Bye-bye.